Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern.
Face is swollen on this. I don't know what it looks like on the inside of my mouth, but I can't even brush my teeth. I can't eat. I could barely talk. I'm finna cry, bro. And look, they think it's monkeypox, so they did a test. It comes back in 24 hours. But if that shit not monkeypox, they don't know what the fuck wrong with me. They already ran all the tests that they thought it was. Negative, 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 negative. It's not no STD. Negative, 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 everything. Bitch. My uncle had some shit like this out to him and I killed him. I killed him.
The WHO is warning the disease could spread across international borders, now confirming a case in Sweden has been linked to one of those outbreaks.
Okay.
In fact, this is what monkeypox looks like.
As of 2 hours ago, is it official that the World Health Organization has declared the 2024 MPOX surge? It is now a public health emergency of international concern. This
is a viral infection. It was originally endemic to parts of Central Africa and West Africa, but we had a big outbreak outside of those areas in 2022 around the world. Most people can contract it through very close and prolonged contact with an infected individual, with direct contact and sexual contact. Those are the primary modes of transmission. People can get pretty sick from this. People have a fever, they'll have swollen lymph nodes, and then there's this classic rash that's very painful lesions all over the body. Most people recover, but there certainly have been some fatalities associated with this. We do have a vaccine that seems to be pretty effective in reducing the risk of infection. And if there is breakthrough infection, it significantly mitigates the severity of infection in those who have been vaccinated versus those who have not. And we do have some treatments available that will help lessen severe symptoms as well. So that's available in Canada. The big issue is rolling those vaccines and therapeutics out in areas that are hardest hit from this in Africa.
Monkeypox has been around for decades in Africa. So why is the western part of the world only paying attention now?
Any disease anywhere in the world that is neglected can spread everywhere. It's important to know that.
The rest of the world didn't invest in fighting monkeypox despite African doctors pushing for more resources for years. Oyewale Tomori has been a leading virologist in Africa. He says the public health crisis comes from countries neglecting the disease.
Before it became international, it was national emergency, wasn't it? So why are we waiting for the world before we begin to take action in Africa? So there's need for a proper study, a better understanding. There are too many gaps in the monkeypox thing that we need to focus on.
While no vaccines for monkeypox were available in Africa as of the end of June, the US plans to roll out 1.6 million doses this year.
I see Europe and everybody rolling out the vaccine. I don't think that's the right approach. The right approach would be identify the cases, isolate them, limit direct contact. In any case, we don't have enough vaccines around to go around.
Tomori is calling on Western media to do better reporting on the disease so it doesn't stigmatize African people.
Monkeypox first came out. The pictures you were seeing of cases in Europe were the pictures of Africans. I said, look, it's your pox. Let's be frank with you. It's your own pox this time. Why are you using my picture?
The main source of outbreak in Western countries has been from sexual contact among men. But monkeypox can be passed through any type of close contact.
First, not to create stigma against anybody, but also to understand that this is how this thing is spread, and therefore you can pitch your response. It is not only through sexual contact that you get it. The contamination of the environment, of your clothes, of your beddings, all those are ways you can get it. So, are we going to forget that?
While monkeypox has created stigma against LGBTQ people, Tomori is warning countries against repeating past mistakes.
We had a similar experience when HIV came. We diverted our attention and focused on the so-called stigma. Then the disease was spreading all over Africa. We shouldn't make the same mistake with this one too.
Monkeypox was a disease mostly limited to African countries like DR Congo and Nigeria. The virus can actually be a self-limiting disease.
If you discover on time, you isolate the patient, limit the direct contact, it will be taken care of on its own.
Well, it's a big deal because this really has been spreading for a few years now, unchecked in African settings, and it's the degree of the outbreak, which is largely in the Democratic Republic of Congo, is so big that it's now spilling over into many other neighboring countries like Kenya, Rwanda, Burundi, Tanzania, Uganda. West Africa is having an outbreak as well. Ivory Coast, for example, is reporting cases. And now we're seeing more exported cases like the one that was identified yesterday in Sweden. So we know it's a communicable infection. If you leave it unchecked, it's going to spread. And by declaring this a global public health emergency of international significance, it really helps focus the world, coordinate resources, enable data sharing, and help facilitate a more coordinated response to this outbreak.
I went to a hospital. It was prior to that time. I have a kidney issue. So I thought it's a kidney related disease. So I consulted my doctor. So he prescribed rocephin injections. He's allowed 5 bottles for me, which I took the rocephin injection and it wasn't getting better. So I have to consult another doctor in the US, Dr. Gibson. So he was like, that it could be a virus infection. So finally, I consulted another doctor, Chuku. So Chuku was like his finger. So he tried dissolving it. I spent a whole lot of money. So at the end of the day, I was like, no, let me visit FMC.
So, and you came, the doctor saw you and the suspected monkeypox,
Yes.
which the sample has been collected. The lab scientists are taking the sample, so you are going for admission. And you know you are going to be in the hospital for a period of up to 7 days or more, depending on when all this, because it's mostly, through contact one can get it. So that's the thing. Just be calm, you'll be fine, okay?
The major problem I'm having is that it's as if there are roasting yam on my head. As in smoke is coming
Come
out
here
of
to
my
your
head.
head, try. So you can see. Okay. So you'll be fine, okay? Thank you.
The situation constitutes a public health emergency of international concern.
A sharp rise in MPOX cases across multiple African nations has led the World Health Organization to declare a global health emergency. The outbreak, originating in the Democratic Republic of Congo, has now spread across neighboring countries that were previously unaffected. The African CDC also declared MPOX a public health emergency. With over 15,600 infections and 537 deaths in the DRC this year, children have been particularly affected, raising significant concern.
This is not just an African issue. MPOX is a global threat, and it is in this moment of vulnerability that we must find our greatest strength.
What is MPOX? MPOX is a viral disease caused by the monkeypox virus, first identified in 1958 and endemic to Central and West Africa. It presents with a skin rash and flu-like symptoms such as fever, sore throat, and headaches. The rash progresses through various stages, leading to pustules that eventually dry and fall off. Transmission occurs through direct contact with infected persons or contaminated materials. Most people recover within 2 to 4 weeks, though the illness can be more severe in children, pregnant women, and immunocompromised individuals. While no specific treatment exists, symptoms are managed with pain relief and antibiotics, and antiviral drugs are being explored for severe cases.
In fact, if you look at the period, the most recent period, the number of cases in Africa is more than triple what it was when the peak was declared in 2022.
Why is this outbreak alarming? The outbreak is driven by a new variant, Clade 1b, which spreads more rapidly and includes transmission through sexual contact. WHO Director General Dr. Tedros Adhanom Ghebreyesus warns that this outbreak is more widespread than previous ones moving beyond isolated family clusters and crossing borders at an alarming rate.
The detection and rapid spread of a new clade of MPOX in eastern DRC, its detection in neighboring countries that had not previously reported MPOX, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.